In the last 24 hours, there have been 106,000 cases reported to WHO, the most in a single day since the outbreak began. Almost 2/3 of these cases were reported in just 4 countries.
With questions with Luisa Duarte from CNN Brazil.
We're very concerned about the rising numbers of cases in low and middle-income countries.
Great. Wasn't expecting such a short question. Every sovereign nation, particularly those with effective regulatory authorities, is in a position to advise its own citizens regarding the use of any drug. However, from the hydroxychloroquine and chloroquine are already licensed products with indications for many diseases. I would point out, however, that at this stage, hydroxychloroquine, norchloroquine have been as yet found to be effective in the treatment of COVID-19 or in the prophylaxis against coming down with the disease. In fact, the opposite in that warnings have been issued by many authorities regarding the potential side effects of the drug.
And on the letter, we have, of course, received the letter and we're looking into it. Thank you so much.
Of the order of 200 million or 100 million a year, which is actually the greatest proportion of funding that we receive from WHO within the emergencies program. So my concerns today are both for our program, and as the DG has outlined, working on how we improve our funding base for WHO as core budget, replacing those life-saving funds for frontline health services in some of the most difficult places in the world. We'll obviously have to work with other partners to ensure that those funds can still flow.
And Dr. Van Kerkhove, thank you, Luisa, for this question. Now we will go to Mexico.
WHO calls for accountability more than anyone, and it has to be done. And when it's done, it has to be a comprehensive one. And it will involve all actors, and it will check all actors.
Let's try to have Corinne from Bloomberg.